I'm Dr. Robbi Alexander, Administrative Director of Psychiatric Services and the Director of the Princeton Center for Eating Disorders at Penn Medicine Princeton Medical Center. I'm an advanced practice nurse with a doctorate in nursing science. Today I'm going to talk about a unique program that helps individuals facing eating disorders learn how goal setting can offer a renewed sense of hope and help to improve their everyday lives. Anyone can feel a sense of hopelessness on occasion. For some individuals who are living with the mental health and chronic physical illness brought on by an eating disorder, these feelings can last longer and they may even become particularly intense. For example, younger individuals with an eating disorder may struggle with concerns about an uncertain future. And older individuals who've lived much of their lives with an eating disorder perhaps may feel that they've tried everything to address the condition and maybe that they've lost the support of their family and friends. They may have internalized a sense of failure or even feel that they've become a burden to their loved ones. Research has shown that individuals who have developed eating disorders may be highly perfectionistic and prone to avoiding risk, which may reduce their drive to explore new things and may limit their experiences, their worldview, and their overall quality of life. They may also develop inflexible ideas or self-imposed rules about food, weight, and appearance. These tightly held beliefs or rules about weight and appearance often contribute to low motivation and a sense of hopelessness and must be challenged in treatment. Recovery from eating disorders involves learning other ways to manage stress and find meaning and worth in life beyond one's weight and appearance. And research has also demonstrated that goal-directed thinking and goal setting can bring a sense of self-worth and accomplishment to those who feel hopeless. This means that continually renewing our motivation and finding pathways and sometimes alternative pathways to our goals can help us feel more hopeful. Tips for using this approach to nurture feelings of hope include exploring your needs, identifying your goals, and then breaking those goals into smaller goals so that they're more manageable and measurable. Anticipating roadblocks and creating strategies to find alternative pathways, and then, of course, building on successes to continually renew our motivation and pathways. Princeton Center for Eating Disorders has created a nurse-led program that's rooted in goal setting to help adult participants identify their pathways to hope. This 4-week research-based inpatient program is part of a multidisciplinary treatment approach. Over the course of the program, we teach participants how to gather the tools they need to identify and reach their goals, whether those goals are related to their eating disorder or to other areas of their lives. For example, perhaps a grandmother who's lived with an eating disorder since early adulthood would like to be able to safely babysit her grandchildren. And while they're there, she would like to be able to enjoy a bowl of popcorn with them while watching a movie without having tremendous anxiety. Even a goal as simple as that can have a large impact on quality of life if it's attained. Throughout the program, we also work on strategies to address roadblocks, which are common in life, particularly for individuals living with an eating disorder. We strive to help the participants develop more flexible, goal-directed thought and encourage them to realize that the pathway to hope may not be a straight line. In order to move forward, they may have to consider alternative pathways and possibly second-tier goals. An example of this approach would be in the case of a student athlete who postpones training to allow time for treatment and recovery, which in the long term may actually serve to improve the chance of being able to return to their sport in a measured and safe way. The program is flexible to meet each person's unique needs. Most participants attend twice a week, and each session runs between 30 and 60 minutes, depending on the needs of the group. This is just one aspect of a comprehensive inpatient treatment program offered by Princeton Center for Eating Disorders for children ages 8 and older, teens, and adults of all genders with serious eating disorders. Our hope is that individuals with eating disorders can find the care, support, and resources they need to overcome this disorder and improve their quality of life.